My name is John Apostolides. I'm a board-certified plastic surgeon here in San Diego, California. I have a practice that consists of about 60% breast surgery, and that's a mix of breast reconstruction and breast aesthetics, and then 40% just general aesthetic surgery. I'm in private practice, and I do most of my procedures out of a hospital setting, both an outpatient facility and inpatient hospital setting. And in my office, I do mostly consultations and follow-ups as well as post-operative management. So one of the benefits with the Prevena application is at the time of surgery, I know what the surgical site looks like. I can apply the Prevena in that sterile environment and really set things the way I want them for that postoperative period. So there's a huge amount of trust in that this device is keeping things the way I want it. So as that patient gets discharged home and goes home for that postoperative period, I have no concerns or I have no worries that something is happening behind the scenes that I'm not witnessing or something that I can't control. So I feel like I have a surgical control in that postoperative period, even when I'm not with the patient or there to monitor things. It's created a consistency in my postoperative management and postoperative follow-up for my patients. Now I can apply the Prevena at the time of surgery and know that within 7 days they'll come in for a check. If they've had the incisional therapy only, then at 7 days we can remove their dressings. And so it's allowed for a very regimented and routine schedule in my postoperative period where we can consolidate those patients and really know when their follow-up periods are going to be. It creates consistency for them, and it also creates consistency in the office for our follow-ups. When I was removing the dressings and I was seeing incisions that looked like they'd been healed for weeks, minimal bruising, minimal swelling, the incisions looked beautiful and the patients were healing well, I was convinced that this was a therapy that was going to be of benefit in surgery. And so for me, seeing that patient experience and seeing the results functionally and aesthetically, I was convinced that this is how I needed to treat all of my patients. What I realized was that there was a benefit not only for the incision, but for really any tissue that had been traumatized or affected with surgery. And with the Prevena Restore, we've been able to maximize the surface area of coverage. So now I can take not only the incision, but the entire area of soft tissue and apply that negative pressure and get that physiologic benefit in that healing. And so for me, it's just expanding the role and expanding the amount of benefit for the patient and for myself in terms of the results and the decrease in complications and the outcomes. The misconception with the Prevena therapy unit and negative pressure therapy is that it's going to compress your skin, it's going to compress your surgical site. And really it's the opposite. Negative pressure therapy is the opposite of compression. It allows you to create an environment or a physiology of decreased inflammation by releasing compression in those areas. What it's doing is it's lifting the tissues up to that area of negative pressure. So it's releasing that pressure. It's doing the opposite of compression. And so it's very counterintuitive, or it's very different than traditional wrapping methods that we used to do or compressive garments that we used to do. It's the opposite of that. One area that I've heard feedback from surgeons is a concern with covering the nipple, whether that's in a breast reduction or in a reconstruction. What we find is the nipple is one of the most vulnerable places in breast surgery, or one of the most delicate areas, and it's an area that we're really concerned about getting successful healing, minimal complications. And so when people tell me that they're concerned about covering the nipple-areolar with a dressing where they can't monitor it, what I tell them is, if that is your area of concern, then that's the area that you want covered in negative pressure. I don't have concerns about negative pressure therapy over the nipple or any sensitive areas or any thin skin flaps, because those are the areas where I see the most benefit in having negative pressure therapy. And for me, I know that in that postoperative period, it's going to take 21 to 28 days for any areas of threatened skin or skin flaps that might be non-viable. That's how long it'll take for them to declare themselves. So for me, there's no benefit in seeing it in the first 14 days. I would not be taking a patient back in the first 7 to 14 days to remove skin that might be unhealthy or non-viable. I'm going to allow it to demarcate, declare itself, allow areas of viable tissue to heal prior to going back for any revisions. The Prevena therapy system has drastically changed the way I use drains in my various procedures in the breast. What I found is I'm still using a single drain when I do a prepectoral reconstruction for a mastectomy. I use a single drain at the time of surgery. It usually comes out at about 14 days, the same time period as my Prevena Restore system. But in cases prior to the Prevena system, I found the drains were persisting for about 3 weeks, in some rare cases 4 weeks. So I have a much more consistent 2-week period where the drains are ready to be removed. I initially began using the Prevena therapy unit with my reconstructive patients, but quickly in seeing the benefits and seeing how well those patients heal, and seeing that a lot of that surgical healing and that physiology is identical to what you would see in the aesthetic patient, I've quickly adopted that Prevena therapy for many of my aesthetic breast cases. What I found is in patients who are having large mastopexies or breast lifts or complex revisional augmentation surgery, the Prevena unit allows me to complement that surgical procedure. And so I've now adopted that in those complex aesthetic cases as well. The same principle applies to my patients who are having fat grafting. Fat grafting is quickly becoming a staple of how we do breast surgery, especially breast reconstruction. It's one of the key approaches. One surprising factor that I've found with the Prevena therapy system is the majority of my patients come back and on their own accord will tell me how they felt there was less discomfort, they felt much more comfortable wearing the Prevena unit. For many of those patients, when the Prevena unit is removed at that 2-week period, that's the first time they tell me that they've felt like they've had surgery. In those first 2 weeks, things felt supported, felt comfortable, and so it really creates a very easy experience for the postoperative period. Prevena therapy is my standard of care for incisional management in the postoperative period. What I can recommend to patients and to surgeons is that with the Prevena unit, you want to take that result that you're creating on the table and you want to protect it and make sure that during that postoperative period, what you're doing in surgery is maintained and is protected so that the outcomes reflect what you've done in your surgical procedure. The patient has gone through a complex surgery, and I want to protect that result while they go into those first few weeks of recovery when things are at their most vulnerable.